the big pictures. And so the way to understand where they are now and where they are going. If not, there is the risk to losing their own direction. And in order to do that, I'd like to talk with you about a couple of business examples we were in, working on our book that was supposed to come out next year. And I had the chance to talk with a company called Monogram Bio. This is a Silicon Valley company. Let me just, in 22 seconds, explain who they are, what they do. The company was founded in 1996. They was previously named Biologic. There was a Genentech spin-off, like mostly of the biotech companies, the Silicon Valley, and probably after the acquisition by Roche of Genentech, we will have a new wave of spin-offs coming out in this period. Currently is a 350 people company, 40 million in revenue, and this company went public in 2000 and was acquired 3 months ago by LabCorp. What they do? A lot of things based on what they say to us. They typically develop a sort of, so they are pretty involved in the field of HIV, and they did not find out, but they found out a way to measure the reaction of the virus to the drugs. So the problem is that the virus became resistant to the drugs, and so they run resistant tests for HIV. They start from HIV, and now they are working on different viruses, and now they are moving on to oncology. So the field is coming big and big. And they do not just do what they call personal medicine, so you send them your blood sample, they run the test and tell you if the drug therapy will be effective, given your personal situation or not, because these treatments are pretty invasive. But they also run some clinical tests for big pharmaceutical companies. So they do a lot of things. And we spent a couple of hours in trying to understand what exactly do. At the end of the day, we were able to try to wrap up. So we were able to define which is the activity list for this company. And this company work in R&D, platform development. They work what they call prototypation, so they transfer technology to the laboratory. They work in laboratory. This is a sort of manufacturing activity for a biotech company. They need to be involved in logistics. They work in business development, sales, and billing. This is all the activities where this company is in. But not all the activities are the same weight nowadays. What are the most important activities for this company today? And there are just two: manufacturing, labs, and sales and business development. So two activities are the most important activities for the company as it's today. And then we try to understand where these activities were located. And we found out that this company is mostly a Silicon Valley company, South San Francisco company to be exact. And except for the sales, where they have people all around the US. And they exploit sales also at the global level through a partnership with Pfizer. And how about the modus of the company, how this activity are run? So if you take a look at the R&D and prototypation, that is what we call a really brain-intensive activity, because you need a lot of skilled, experienced people working there. And it's also an high-tech activity, because a lot of technology is involved. Not particularly, you do not need too many people, just really skilled people and a good technology. Manufacturing and sales are different. It's mostly a labor-intensive activity. Not particularly tech-intensive, and not particularly brain-intensive. Sales activity is more brain-intensive than manufacturing, because in order, your customer are physicians, so you have to be able to talk with physician about this disease. So you really need to be pretty experienced, you really need to have a pretty good knowledge, and you have to be able to discuss with them also about science. There is a liaison committee that support them. And so this is the picture of the company. As you can see, a lot of activities, a lot of different focus, different locus, and different models. So we can wrap it up this way. If we take a look at the big picture, where is this company today? This company is mostly a labs and sales company. The locus is just Silicon Valley, most of it. and the modus is in. This company is a company that do everything in-house. What about their business model? The business model, we can wrap it up in that way. We can help them to plan, going activity by activity, defining the focus, the locus, and the modus, but at the end of the day, we are able to also to wrap up. And what Bill Young told me after the interviews that we have is, okay, I thought that to have a different business model, because I thought to manage oncology in a different way than virology. And they didn't. They exactly do the same thing. And I thought to manage the pharma collaboration in a different way that we do for the personal medicines, and they didn't. They do exactly the same thing. So sometimes managers, because they are confused by this, a lot of these options, a lot of these day-by-day decision, they find to do different things in a different way, and sometimes it's not true. But the business model will be changed, not the locus. The locus is pretty the same. The company was a Silicon Valley company, and still it is. The modus substantially did not change because just the billing with the experience to outsource, and then they bring it back in. But the focus changed because this company, if we take a look at the same company, 5, 6 years ago, it was a different company. It was mostly an R&D company, and now it's mostly a labor manufacturing and sales company. So this opens the door to the second thing that I'd like to spend a few time talking about. That business model can evolve and change. So day-by-day companies make decisions affecting locus, modus, and focus. Not all of them are radical changes. Some of them are not, are just a fine-tuning. But the sum of all these decisions can bring you really, really far from home. So you can